Hello, my fellow YouTubians. This Miss MA Student 10 coming back at you. Got that little update on clinicals? Yes, I do. Good, very, very good update. I have been doing clinicals. This week today was my third rotation, and I was local in my own city, my own town, and I was at a family practice today, and I love clinicals so much. I loved it, loved it, loved it. But I'm gonna rewind back to the first week. My first week, I went to the urology clinic at a big hospital. This hospital is combined with a medical school, and it is huge. I had to park like at a grocery store, like way, 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 way down the street from the hospital, and I had to catch like a shuttle bus to the hospital. I don't know why you can't park in the parking garage, but that's just the rules my school has. So I get there early. I go catch the shuttle bus to the big hospital, and at that time my instructor wasn't there, so I just waited around a little bit, nervous of course, even though not my first time at clinicals, a clinical site. I was still nervous. First time at the hospital, and there was so many other students. It was like medical students, physician assistant students, just so many variety of students. And here, little old me, little old medical assistant, I just felt like, gosh, whew, little old me, like in a big place like this, I just felt like this small because I don't know. But anyway, it was pretty cool, just be out there with different types of people. But anyway, after my teacher came, she examined me and her other students. It was my instructor over the not over my class, but over the whole medical assisting program. And she examined all of us. She made sure our hair wasn't touching the collar, made sure our nails were not over our fingertips. She made sure that we weren't wearing any earrings, or that we didn't have on too much makeup or anything like that. And that was it. She made sure we had our stethoscope and things that we needed. And then she took us up to where we were going. I went to urology on the fourth floor, and I enjoyed it. I really did. I basically, because this is my third quarter, I really don't know. I really haven't done that much. I just took vital signs and showed patients to their rooms. I did get to see two procedures. I don't remember what they're called, but it was one patient where this lady, she had cancer of the uterus, and she had cancer all over, off and on. And at that clinic that they had been seeing her at, they had been seeing her like over 7 years, and she's a fighter for real. Like she's been battling cancer off and on. And they was like, before the procedure, there's the nurses and the doctors talking about how nasty her bladder looks like. A normal bladder is like have a smooth texture to it, but her bladder was all bumpy and stuff. And I thought they were exaggerating, like, come on now, bumpy and nasty looking and all this stuff they were describing. Like, gosh, like, it can't be that bad. Well, when I went in there and I looked at that screen, oh my goodness. Okay, they put a tube, of course, in her urethra, and they examined the bladder. They showed me the normal side of her bladder, and then they showed me the inflamed side. Oh my goodness, it was just how they described it, probably worse. But it was like very bumpy, very red, and it just looked so nasty. Like the veins and stuff. It just looked so nasty. It's a sight that I would never ever forget. But that was pretty cool. And I saw another procedure where they went through a man's urethra, which I know was painful for him. He did his best though. They went through a man's urethra, and he had a kidney transplant, and they for some reason put a stent in his bladder, and they removed the stent. It was pretty cool how they put the instrument down his urethra, and the instrument opened up, and it grabbed the stent and it just removed it out. And they had a nerve to ask, did he want it? And the man was like, no, I don't want. Like, are you crazy? Why would I want that? It's been up inside of me. I don't want that. But anyway, I just thought that was crazy. But I enjoyed it. I really did. Next week, fast forward to the next week, I went to an OBGYN office. Another clinical that I loved so much. Very, very, very much. I got a chance to do vital signs, test PP all day long, do pregnancy tests, help with exams. I actually saw a woman's cervix of a patient's cervix of her having HPV, human papillomavirus. It's horrible also. She also had chlamydia and stuff, which I can't believe it. And it was somebody like it was in my hometown, and I didn't really like know the girl, like talk to her, but I did know of her, and I just kind of stood back a little bit because I know she was kind of like nervous, but I know for a fact that I'm not saying no names or anything like that, so she don't have nothing to worry about, because patient confidentiality, HIPAA, I'm not violating that at all, because I do want to get a job when I get out of school, okay? So she don't got nothing to worry about like that. But I did know of her, and I didn't know she had all those problems. It's like, it was hard for me. I felt bad for her and everything, but it's like, you never know. Like, to all the men out there, to all the women out there, somebody can seem perfectly normal, and you have no idea that they're walking around with these type of diseases because they look normal. And it's just sad. Like, so many patients had AIDS. Like, I was just blown away. Like, I just didn't know that all that was happening in my little hometown. But it was just something, quite an experience. Most patients that came in were just regular annual paps, and not really pregnant women, because it was OBGYN. Some pregnant women. I was a little nervous about women having attitudes and stuff, how when they're pregnant and stuff, but for the most part, they were pretty nice. They were happy-go-lucky. They were happy to go pee-pee for me and fill the cup up all the way when I didn't even need that much pee-pee, and then, the odors of the pee-pee, but that is another story to another topic for another time. But anyway, I enjoyed it. I really did like it. So fast forward to my third week. Today I went to a family practice. The doctor wasn't there, but it was another doctor, filling in for him while he was gone. And I really enjoyed it. I worked with the MA, and I did vital signs, showed patients to the room, same room, yada yada yada. I tested urine again. I did some filing, which I love. I love filing. I don't know why, but I do. I thought I would hate working in the front office, but so far and I have worked. It's been okay. It hasn't been that bad. I was actually hanging out a while up there today, the front office part. When it got slow in the back, I would just come and hang out at the front. But it was pretty cool. I watched as my MA gave some injections and everything, and I learned a little bit, not quite that much today as I learned at other clinical sites, but it was okay. I really enjoyed it. It was a student from the high school there, and me and her really like hit it off. Like she was pretty cool. Like, and then like as I was about to go home, she was like, "I hope you come back because the MA here that worked with you, she said that you're a really good medical assistant student, and that she really liked you and everything." And I was like, "Oh, that's great. She needs to tell my teacher that, so I get some brownie points or something like that." But anyway, overall it was a good day. I really enjoy clinicals. It's like the highlight of the week. I go to clinicals every Thursday, and then I go back to class on Friday from 8 to 10:50, and I get to share with my class, my experience with clinicals and at the place I visited, because we all rotated at the same area, at one point in time during this quarter. But that's about it. I really enjoyed it. And I will keep you updated on more places that I attend, during my clinical rotation. Until then, happy schooling. Bye.